Pulmonary arterial hypertension or PAH is a type of high blood pressure that affects the arteries in your lungs and the right side of your heart. In PAH, the walls of the pulmonary arteries become narrowed, thickened, or stiffened, which makes it harder for blood to flow through them. This increased resistance in the pulmonary arteries forces the right side of the heart to work harder to pump blood through the lungs, leading to the enlargement and eventual weakening of the heart muscle. FDA has approved a new medication to treat pulmonary arterial hypertension. This disease causes the blood vessels in the lungs to shrink, increasing blood pressure and the risk of heart failure. In a research trial, the new medication reduced the risk of death or reduced the disease by about 83%. Merck, the maker of the medication to market this drug, soon giving hope to millions suffering from pulmonary arterial hypertension. PAH can result from various underlying conditions, or can occur idiopathically, without a known cause. Some common causes of PAH include connective tissue diseases, such as scleroderma or lupus, congenital heart defects, liver disease, cirrhosis, HIV infection, use of certain medications or illicit drugs, genetics, inherited forms of PAH. Disclaimer: consult your healthcare professional before making any changes to your medication or lifestyle. Symptoms of PAH can include shortness of breath, fatigue, chest pain, fainting, swelling in the ankles or legs, and a bluish color to the lips or skin, cyanosis. PAH is a serious condition that requires medical diagnosis and treatment. If left untreated, it can lead to heart failure and other complications. Wait, there is more, but do not forget to hit the like button and subscribe, down below. Treatment for PAH aims to reduce symptoms, improve quality of life, and slow the progression of the disease. Treatment options may include medications to dilate blood vessels, reduce blood clotting, or lower blood pressure in the lungs, as well as oxygen therapy, lifestyle changes, and in some cases, lung transplantation. Early diagnosis and treatment are crucial in managing PAH and improving outcomes for affected individuals. What are the medications for PAH? Several medications are used in the treatment of pulmonary arterial hypertension or PAH. These medications work by various mechanisms to dilate blood vessels, reduce blood clotting, or lower blood pressure in the lungs. Here are some of the commonly prescribed medications for PAH. Prostacyclin analogues. These medications mimic the effects of prostacyclin, a naturally occurring substance in the body that helps dilate blood vessels. Examples include epoprostenol, Flolan, treprostinil, Remodulin, and iloprost, Ventavis. Endothelin receptor antagonists, ERAs. ERAs block the action of endothelin, a substance in the body that causes blood vessels to narrow. Examples include bosentan, Tracleer, ambrisentan, Letairis, and macitentan, Opsumit. Phosphodiesterase 5, PDE5, inhibitors. These medications help relax blood vessels by inhibiting the breakdown of cyclic guanosine monophosphate, CGMP, a substance that promotes vasodilation. Examples include sildenafil or Viagra and tadalafil or Cialis, both of which are medications used to treat erectile dysfunction. Soluble guanylate cyclase, SGC, stimulators. These medications stimulate the production of CGMP, leading to vasodilation. Examples include riociguat, Adempas. Calcium channel blockers. Normal blood pressure medications called calcium channel blockers may be used to relax blood vessels and lower blood pressure in the lungs in some cases. However, they are only effective in a small subset of patients with PAH who respond positively to vasodilator testing. Anticoagulants. These medications help prevent blood clots from forming in the pulmonary arteries, reducing the risk of complications such as pulmonary embolism. Examples include warfarin and newer oral anticoagulants like rivaroxaban and apixaban. It is important to discuss treatment options with your healthcare team. So far, choice of medication and treatment approach for PAH depends on various factors, including the underlying cause of PAH, the severity of symptoms, and individual patient characteristics. Treatment plans are typically developed by healthcare professionals specializing in pulmonary hypertension, such as pulmonologists or cardiologists, and may involve a combination of medications, lifestyle changes, and supportive therapies to manage the condition effectively. Regular monitoring and follow-up are essential to adjust treatment as needed and optimize outcomes for patients with PAH. Does normal blood pressure medication help? While medications used to treat normal hypertension, high blood pressure in the systemic circulation, are not typically used as primary treatments for pulmonary arterial hypertension, PAH. There are some instances where they may be beneficial adjuncts or used in specific circumstances. Calcium channel blockers, CCBs. In rare cases, some patients with PAH may respond positively to calcium channel blockers. This response is typically seen in patients who undergo vasodilator testing and demonstrate a significant drop in pulmonary artery pressure when given these medications. However, only a small percentage of PAH patients fall into this category, and calcium channel blockers are not the primary treatment for PAH. Diuretics, which are commonly used to treat fluid retention and reduce blood pressure in systemic hypertension, may be prescribed to manage fluid buildup, edema, in patients with PAH. They can help alleviate symptoms such as swelling in the ankles and legs by reducing excess fluid in the body. Anticoagulants. While anticoagulants are primarily used to prevent blood clots in the systemic circulation, they may also be prescribed for patients with PAH to reduce the risk of blood clots forming in the pulmonary arteries, which can lead to pulmonary embolism and worsen PAH symptoms. It's essential to recognize that PAH is a distinct condition involving high blood pressure specifically in the arteries of the lungs, and the treatments for PAH target the pulmonary circulation differently than those for systemic hypertension. The medications used for PAH are designed to specifically target the underlying mechanisms contributing to the disease, such as pulmonary artery constriction and vascular remodeling. Patients with PAH should work closely with healthcare providers who specialize in the management of pulmonary hypertension to develop individualized treatment plans that address their specific needs and optimize outcomes. This may involve a combination of PAH-specific medications, supportive therapies, lifestyle modifications, and close monitoring to manage symptoms and slow disease progression. Do not forget to click the like button and subscribe. Up above you see a video related to health. Thanks very much for watching this video. Subscribe to my channel. See you in the next video.